Natasha, you're muted.
All right, thank you. You can see me talking to you and hearing nothing. Thanks. So yes, we are going to get started with a firearm safety presentation by Aslan and Braden, and that will finish up our adolescent unit. And then we will follow up with a review for exam 6. Okay, so Aslan and Braden, are you guys ready to come on camera or mic?
Yes.
Perfect.
Yeah, I'm here.
All right, go ahead and take it over.
Okay, so our presentation is on firearm safety for all ages. And then if you just want to switch.
Sorry,
Okay.
I accidentally clicked ahead. Okay.
Okay, you're good. So just one more slide forward. Thank you. Okay, so basics of gun safety. So just like you never point a gun in the direction of another person, ever, like anything. Always keep it pointed at the ground, like in front of you. And that's just something you should teach everybody. Like you just don't ever point it at anybody. You keep your finger off the trigger as well until you are ready to fire. And then just like some basic things like keep the gun's chamber empty when it's being stored. Take the clip out before you store it, and then store the clip and bullets in a separate safe than you do with the gun. And then you should teach all family members how to safely use a gun. So this isn't really the nurse's like spot to teach this, but it's the parent's responsibility to go ahead and make sure that like everyone in their family is aware of how to use a gun properly and everything. And then so you should never allow children to access guns without proper supervision. And that basically goes for all ages, like toddlers up to like teenagers and adolescents. Like if you don't know how to handle it safely or you don't trust them to like use it properly, they should not be alone with a gun. Another thing to know is that you should never leave a gun out on a table. In particular with toddlers, so if you want to go to the next slide. So with toddlers, like they shove everything in their mouth. They are so curious and they climb all over things and they will grab that gun and they will use it. So even if it is unloaded and there's not a bullet in the chamber, like you should never leave a gun out for a kid to get a hold of because it's seen as a toy. And if they learn that that's a toy and then eventually one day it has a bullet in it by accident, they could really hurt themselves or somebody else, and that could devastate a whole family. So precautions that you should always take are to have locks on the safes that are up and out of the way for toddlers, and then make sure that your guns are always unloaded. Parents should teach that guns are dangerous and that they're not a toy, and that like keep them away from toddlers. So like Poland says, the injuries and deaths like related to firearms increase steadily for children and adolescents. They could have been properly prevented by like storage and training in the use of firearms. So really all it takes is just like family to teach each other about like this isn't a toy and we don't play with it, like be safe. And if you want to go to the next one. So then firearm safety for adolescents. So this is kind of a weird spot. So like most of the time, if they're going to be around guns, they will know how to handle them at this point, and they will be aware that they're not a toy. But they're also going through a lot of changes. Their hormones are crazy, peer pressure, like from their friends. They're usually like socially isolated at this point. Maybe they've lost a lot of their peers. So if they come into the wrong group who thinks guns are cool and like they want to play with them, they could totally drop all the safety that they've learned and just like use the gun improperly. So precautions that should be taken by the parents are like hiding the keys. So you keep the bullets and the gun apart from each other, always in 2 different safes, but you should hide the keys for both safes in different spots as well that like only the parent knows about. So that like if the kid manages to find it and they're just being dumb one day, they don't get a hold of both the bullets and the gun. They just get like one or the other, which is not good either way, but at least they're not getting both and like hurting themselves potentially. So you just need to be wary of like their fluctuations in mental health. And then like the parents' responsibility is like they should talk to their adolescents about mental health, and how to like talk, like be open with them and everything, and also like safety with guns still. But healthcare workers should like be wary of this as well and watch for anyone who's depressed or maybe like showing signs of suicide. We need to listen carefully and try to understand the person's feelings in addition to the actual words being spoken. And then don't undervalue anything they say. Like always take it seriously and watch for them, and then talk to the family about it so that they can take the extra precautions at home as well. And then if you want to go to the next one. Okay, so a little bit more on adolescence. So specifically, young men are most affected by violence and suicide. And then factors that can contribute to suicide are depression, low self-esteem, poor impulse control, substance abuse, and emotional isolation. But it's also important to remember the peer pressure here, because a lot of those can go with that. And then like combined together, it just makes a big mess. And then unintentional injuries and homicide rank as the leading causes of death for 15 to 19-year-old minority group or minority youth, regardless of their gender. So it's important for everybody to be aware of gun safety and to be safe and follow these precautions. But it's also important that if you're taking care of somebody who's a minority youth, that this could be a bigger issue for them in their future. And you should be aware of that and help educate the families and watch that adolescent as much as possible. And then if you want to go to the next one.
Cool. You want me to take over here, Aslan?
Yeah.
Okay, awesome. Thanks. So a big nursing intervention that we can do to kind of help our adolescents. Like we've all seen, like in the last few years, it seems like there's been an increase in violence and shootings and things like that that have happened in schools, and a lot of that seems to involve, teenagers that are, just having some issues, right? They're having either like some mental issues, or they've been picked on at school, different social issues, things like that. And I mean, there's a lot of different things that can be done to try and like prevent this. Like a big one I feel like is that they shouldn't even have access to the firearm at all. But other ways that like a nurse can help and intervene in these kind of situations is a community educator. We can go around and like, I mean, not necessarily even going around to hospitals and things, but like even whatever job you're at when you have interactions with youth, promoting healthy ways for teens and adolescents to deal with aggression and safe ways to relieve the stress that they may be feeling in non-violent ways that wouldn't hurt others. And then also, like Aslan was saying, to monitor for those signs of like depression and possible lashing out that can happen. And just being someone that people can talk to and kind of vent can be a big thing. So like being a friend to everyone helps. So can we go to the next slide? Okay, so firearm safety in adults. A lot of the basics carry through, like similar with the toddlers and the adolescents. But at this point, adults are adults. They can use firearms if they want, but they should never be using one if they're not familiar with how to use a firearm, right? So we still need to make sure that we're being safe. They're getting educated on how to use it and how to use it safely. Like never point it at people that you're around. And then, like anything that you might value, don't point the gun at that either. So gun safety and teaching would also be a big help. Another thing we see in older adults, the suicide rate tends to go up a little bit higher, like depression tends to increase as adults get older, like they lose different abilities that of activities they might have been able to do while they were younger. And so, we have the suicide that happens. And a lot of times that will involve a gun. Men are more likely to commit suicide, and then they're more likely to use a gun. to go in that kind of violent manner. In that kind of violent manner. But we need to keep an eye on our older adults and just see how they're doing, like cognitively, if they're having cognitive decline from like some kind of dementia or Alzheimer's, then it'd probably be best to pull that firearm away. And then just like abnormal aggressiveness, withdrawn attitude, things like that. So keep an eye on your older adults and be there for them too. Can we go on to the next one? Okay. So we've talked a lot about like the safety of how to like handle a firearm and like around our kids and adults. But like a big point is knowing how to safely store a firearm. So there's a lot of different methods, and I just put a few of them on here. A lot of the most common ones are like having a firearm safe or a gun vault, right? And you can see that in the top left picture is like a picture of a pretty typical gun vault, and how you can fit a lot of stuff in there. And those are usually really secure as long as other people who shouldn't be accessing it, like our adolescents and things, don't like have a key to it, or like the combination. Most of them have a combination lock. Some people who only have like one small like handgun, they'll use like these small lock boxes, like in the top right hand picture. These ones work well, but they're not as secure because they've just got like this one, for example, has like 4 little buttons and you make your own combination. But I feel like the combination is a little bit easier to crack. So I'd be wary of those. And then another one that we actually might see in our healthcare professions are the cable locks for guns. And the bottom 2 pictures on there with the handgun and then the assault style rifle both have cable locks on there. And so it's like a padlock, except with one, instead of a small round loop, it's like this big long cable that loops around. And what you do is you feed it through like the chamber or the action of the firearm, and then you lock it, and it prevents the firearm from like fully closing into a position where it can be used, or from like letting a round get into the chamber and letting a bullet get in there. And these are like super common. A lot of times, like I work outpatient healthcare with the U of U, so I work in their doctor's offices and things. And a lot of our clinics actually have these just stored away, like in case anyone ever needs one. Like if they feel like their firearms aren't safe, we can hand them out. A lot of times we'll check when people come in with their newborn babies. We'll do like a parent check just to see how the parent's doing, and we'll ask about having firearms in the house, and if they have locks for them. And if not, we'll offer these cable locks. But they're pretty handy because they're universal for just about every kind of firearm. So you can use like any combination of these storage methods to help keep them safe. My personal preference is to use a cable lock on a firearm and then also place it in a safe and lock it, and then have my ammunition somewhere else. So I mean, I try to be ultra secure so that, you know, I don't have any terrible situation that happens, because I hear about it. I haven't ever actually experienced one, but I want to avoid it. We can go on to the next slide. So for our learning activity, we just kind of wanted to get some input from you guys on experiences that you, or maybe like a family member or friend that has had, that's kind of changed your view on firearms. Like it can be a good experience, bad experience, but it just like kind of changes the way you view or handle them. So if anyone has any input, we'd love to hear about that. I'm assuming we're getting something. I see typing.
If you guys need like clarification or whatever, it's just like my dad was really strict about it and like threatened to cut off my fingers as a child if I like went near the gun, which he would never do. But like it's definitely shown me to be like safer with guns and like keep them up out of the way.
So it looks like Stephanie, your whole family took the safety classes and then got permits. Okay, there you go. I mean, that's always good, because like the concealed carry classes that they have, like they're really good resources for, I mean, just learning about firearms, firearm laws, and how to be safe with them. see, Ashley.
Oh my gosh, Ashley, that's terrifying.
Oh my
I would have
gosh. Yeah,
died.
that would be pretty freaky.
Oh my gosh.
Amy, I'm sure your friend was very interesting to the TSA. It was probably on their watch list for a little while.
Yeah, Natasha, that's scary too. Especially, I imagine you were younger, like a younger
Yeah.
teen. I would have cried.
Oh my gosh, Shelby. I'm
All
so
of you
sorry.
guys. Oof. Yeah, so basically just like lesson learned, right? Like don't point at anybody
Yeah.
and keep it up out of the way. Like let's be safe.
Never get lax. Always take like every precaution. Like yeah, like every little thing. It may seem overkill, but it's really not if it can help prevent a life. Like personally, I grew up around firearms and I haven't had any issues, but I feel like I got proper education growing up and I was never allowed to be alone with one until I bought my own when I was like 19. So I like to go trap shooting.
That's good. You can't be too careful.
Wow.
So,
A lot of stories.
yeah.
So the next slide
No,
is just like the reference
I'm like,
thing, Natasha.
I like to shoot, but I'm not fantastic at it.
Oh, I have some funny stories about shooting when I was in the Air Force. They trained the nurses to operate a handgun, so we can protect our patients if the enemy enters the tent.
There you go.
Yeah.
I mean, I guess you're prepared to like protect your patients, but then you're also prepared for the aftermath, right? Like after you've shot the person, you can go and attend to them as well. I guess your patients are your priority, but then potentially you've got a new patient.
Right. Yeah, so I have some interesting stories. I'm not going to share them here.
Yeah, that's fine.
Some are funny, some are horrible, but yeah.
Okay, awesome. Thanks for all the feedback, guys. And then that was pretty much the end of our presentation. We've just got our references at the end.
Oh, yeah, let's bring those up. And you guys have a nice handout. I hope you guys are all looking at the handouts that your classmates have posted. Lots of excellent information. Wow, you guys have done a super job. So I talked to Carol, and we're going to increase the value of the presentation to 500 points instead of 100 points. So I'm going to increase the value, and then I'm going to go in and fix everybody's points who I've already given 100 points for, and I'm going to give you your 500 points. But if you check in between when I increase the value and when I of the assignment and when I get yours increased, it might look for a minute like you're only getting 100 out of 500, but don't worry, I will get that fixed. Okay, yeah, you guys are all doing fantastic. So I told you I was going to look for the video on teen slang about quarantine, which I found. It's a little longer than I remembered, so I'm just going to share that at the very end. And anybody it's just for fun. It's like a comic sketch for a Seth Meyers show. Anyway, so I'll do that last thing, and if you are interested in it, you can hang into the bitter end. Otherwise, we will just move right into the test review. Let me bring up the right. Here we go. Okay, so what I'm going to do first is I'm going to do a quick review, and then I've got some sample test questions that we can do after we review. I was thinking, since you had a test this morning in 1025, probably a lot of you didn't get a chance to review your 1040 notes, since the 1025 would have been the priority for the exam. So, okay. I'm trying to move my camera so I'm not looking away from it. All right, so infants, actually, let's start by looking at the table, the growth and development table, and then bring up that other page. So, I am going to quickly highlight some things. And the things I highlight, I recommend that you actually physically highlight if you've got a way to mark these things, or to just kind of put a star by them or circle them, because these are the most important things, the key things to remember. So, and I'm just going to go line by line with each of the three tables for this exam. So starting with infant, remember that infants grow an average of 1 inch a month and they progress in a cephalocaudal. Their growth is in a cephalocaudal or head to toe direction. Teething can begin as early as 5 months, and often it's starts around 6 to 7 months. And the birth weight triples by the time they are a year old. For gross motor, they can sit alone generally we want to see that they can sit alone by around 7 months, start crawling at 8 to 9 months. Fine motor, they can use the pincher grasp at 7 to 8 months. Let's see, for verbal, they can speak 4 to 6 words by the time they're a year old. Nutrition, colostrum is really the best food because they get immunities from the mother's breast milk. And by the time they are 6 months old, they should be given foods that are high in iron, because their iron store starts diminishing at that point. Okay, the issues we're going to talk about on that other sheet that I had brought up first, and comfort measures as well. So moving on to toddler. The earliest they can develop sphincter control for like urination and bowel elimination is at 18 months. So it may develop anytime between 18 to 24 months. Let's see. For gross motor skills, they can start running, although clumsily, around 18 months. And they can climb stairs by the time they're 2 years old. Fine motor skills, they can build a tower of just 2 to 3 blocks at 18 months, and by 2 years they can double that height at 6 to 7 blocks. And they can start to dress themselves just by simply pulling clothes off and on. They don't have the dexterity to do snaps and buttons and that yet, but they can pull a t-shirt off or on, and same with shorts. They can hold a crayon or and draw or a pencil and draw simple lines or circles, and they can turn knobs at 3 years of age. Let's see. Oh, I didn't mention this. For infant, always know what all of your Piaget stages are. Keep them all straight. So Piaget for infant is trust versus mistrust. And that's Erickson. Erickson is trust versus mistrust. Piaget, he's the sensory motor stage, and the graduation from that is the end of the infancy. The graduation from the infant stage is they learn object permanence and moral development. They're pre-moral as infants. Okay, let's go back to that topic under toddler. Erickson's psychosocial stage for toddlers is autonomy, which is kind of like independence, and versus shame and doubt. They have parallel play at this age. And then Piaget's stage, sensory motor, continues through the toddler years. Through age 2. And starting at age 2, they start with the pre-operational, which is the animistic thinking, egocentrism, things like that. And moral, Kohlberg's moral development also steps up at age 2 to where they are motivated by avoiding punishment. Let's see, they can be disciplined starting at age 2. They can be disciplined with time out. If time out is not recommended for any child less than 2 years of age, because they don't have the ability to understand why they are being punished before that. Okay, for nutrition, they at 12 months, at their first birthday, they can graduate from formula or breast milk to whole milk, and they should continue drinking whole milk until their second birthday, and then they can graduate to low-fat milk. Yay. We should encourage parents to have children limit their sweets as toddlers, and also if they experience any food jags where they just want to eat one type of food and one type of food only, we tell parents not to stress about it, because those are usually very short-lived and it's not concerning, it's not worrisome. And we will talk about issues in a bit. Okay, moving up to preschoolers. They develop a slimmer figure in the preschool years because they lose the adipose tissue, and their legs, their extremities are growing more quickly than the trunk and the head are, so their body kind of elongates. And they take on more adult proportions. For their gross motor skills, they can take stairs with alternating feet as preschoolers and hop on one foot at 4 and skip and jump rope at age 5. For fine motor skills, they can dress a little bit more independently, in that they can do buttons and snaps and zippers. They can use utensils well as preschoolers. Okay, for Erickson's stage, they are at initiative versus guilt. Remember, initiative is kind of, they're taking the initiative to explore. So remember, Dora the Explorer is the mascot for preschoolers, and so exploration goes along with initiative, because they are just seeking out their own things that they want to do and experience. And they have 2 types of play. The first one is, actually these are written in associatives is the earlier stage. That's the one that's just one step above parallel play, where this is the one, picture them playing on train tracks where they have to interact, but it's not any organized manner, or there's not a common goal. They just learn how to negotiate working around each other with associative play. Whereas cooperative play, they do have rules, they have a common goal, and this is your hide and seek, cops and robbers, etc. School, playing school. And then cognitive, which is Piaget, they continue with that pre-operational stage through the end of their preschool years. And that means they continue with the egocentrism and the imaginative, magical thinking. And Kohlberg's is the pre-conventional. This is stage 2, where they are motivated now a little bit more by rewards. For discipline for this age group is it's important to use consistency to enforce the rules, and consistency in that the rules are always enforced the same way, no matter the circumstances. I mean, it doesn't change from day to day or moment to moment. The rules are consistent, and the parents are consistent with each other, or any of the caregivers. Okay, so for verbal, they love to talk just to hear themselves talking. So they might just be jabbering, talking out loud without really wanting to communicate with anybody else. And also they like naughty talk, naughty words, such as swear words or potty mouth type of things. And the issues we will get to now. So let's go ahead and go back to infant. We're going to start at infant again and discuss the different issues. So I did not share this document with you intentionally. So this is just here on the review. You can't print it out. I am not going to send this document to you, but it's got a lot of information that is important for the infant, toddler, and preschool age groups. So this is the highlight of the topics that I've taught you. All right, so infants start out with passive immunity that they got across the placenta or anything that they happen to get in the breast milk. And they do need to develop their own immunities, which is done through immunizations and through exposure to microbes in their environment. It's good for infants to be read to and get lots of stimulation. Thumb sucking and the pacifiers are helpful, although it's best if they don't suck their thumb or use a pacifier after they're about 12 months old. So it's good for infancy because it's a self-comforting behavior, and so it's a positive thing for infancy. A pacifier also happens to decrease the risk for sudden infant death syndrome. We already mentioned the nutrition there. Sleep safety is to place infants on their back to sleep, not on their tummy, because that is associated with sudden infant death syndrome. Also, no suffocation hazards in the crib, such as stuffed animals or the bumpers that they used to sell. The idea was they thought the bumpers would keep the kid from bumping their head against the bars at the crib or putting their limbs through, but it turns out they were a suffocation hazard. So no bumpers. Never put the baby down to bed. So this is things we're teaching the parents. Never put the baby down to bed with a bottle. And even breastfed babies can get dental caries. So good oral hygiene is to clean the gums even before the teeth come in, and especially once even the first tooth comes in, teach parents to start brushing the teeth as soon as the first tooth erupts. The reason why we do developmental testing, we encourage parents to kind of monitor their own kids' developmental growth, is so that we can be aware of any delays, developmental delays, and provide early intervention. Disciplining in infancy is for protection and avoidance from harm. So the important things to do for that is for infants is distractions can help pull their attention away from the activity you're wanting them to avoid. Protection always keeps the environment safe. You can start saying no, but you can't trust them not to do it just because you said so. So they still require supervision. Infants should never be left unattended. And also praising the positive is really helpful for infants. Okay, toddlers issues. First, for hospitalization, since they are in that autonomy where they're wanting more independence, they tend to feel kind of powerless in the hospital setting. So you want to help give them safe choices. Let's see, like asking them what kind of Band-Aid they want, what picture on their Band-Aid, etc. Regression is common because that is a source of stress, and regression happens when there's any type of stress where they kind of go backward in their development. They start with separation anxiety as early as 8 months, and it just gets progressively worse into the toddler years. So toddlers are especially prone to anxiety if the caregivers can't be with them. And they also fear unfamiliar surroundings. And the loss of their routine is also very disturbing to them, because routines are super important to toddlers, and they have a fear of experiencing pain. So let's see, the cephalocaudal growth and development from head to toe. An example of that is the Babinski reflex is the last one to disappear, and that happens by the time they're 2 years old, sometime between their first and second birthday. Toilet training. So we don't even start with toilet training until they've got the sphincter control. So at the very least 18 months, and possibly not until closer to 2 years old, depending on when they develop that sphincter control, and also that they express some sort of awareness of having a wet or dirty diaper, and that they're interested in the potty. Best way to do it is through praise and positive reinforcement. Echolalia, that's where the child learns speech by repeating syllables like la la la, bam bam bam, like we saw in the video. It is normal up until 30 months, which is 2.5 years. After that, it's considered a sign of autism. Temper tantrums are, common because they haven't learned impulse control. And so if they don't get their way, they express their frustration by throwing a tantrum. And so the caregivers should be taught to respond very firmly and matter-of-factly in just a simple statement. We don't do this. So don't try to lecture, reason, beg, plead, or reward or punish. None of those things. Just a simple, firm statement of what behavior you want to see in as few words as possible, and then just wait for the child to get control. Never give in to the whim or their wishes, or you'll just get more and more of that behavior, because that is rewarding. Let's see. We want to teach children by offering rewards, but not in that praise, not rewards, praise and recognition, but not rewarding bad behavior. Okay, preparing the toddler for a baby sibling. This goes along with our sibling rivalry presentation. So it makes the toddler feel insecure when they see the baby getting lots of attention. And so it helps if parents are taught to give special one-on-one time with the toddler so that the toddler doesn't feel totally misplaced. Don't ask the toddler to share their favorite toys with the baby because they see their toys as an extension of themselves. So ask the toddler, however, what does work is to give the toddler a special responsibility for the baby and their baby. So it's referred to as our baby, not mommy's baby. Something simple like the toddler is the one who brings the clean diaper, or when they do a diaper change or something like that. And I think that's it. Thumb sucking is continues to be self-soothing, but we do want to start discouraging it in the toddler years. Try to get them done with thumb sucking as early in the toddler years as possible, because remember the goal was to be done with the pacifier by 12 months. So after 3 years, it can cause malalignment of the teeth. So definitely want them done with thumb sucking by the time they're 3. I mentioned regression is a result of stress, often seeing it with hospitalization with a new baby in the house. Nutrition, I mentioned the milk. Okay, and I mentioned food jags. Use sweets and treats sparingly and not as rewards. Okay, nutritional precautions are to avoid choking hazards such as hot dogs, peanuts, and candy. Safety, toddlers are at risk for poisoning, so make sure any potential poisons are kept out of reach and under safety lock. Toddlers are prone to accidents, so make sure that their environment is safe, because they are likely to push their boundaries in exploring, and they're totally not safety conscious. So they are just looking for what interests them and not thinking through what could be harmful. Always supervise infants and toddlers when they're around water. With an infant, you got to have your hand on them if they're in the water, and with toddlers, be right there with your eye on them constantly. It's never too early to start teaching them to swim. Even infants can be taught how to swim. But definitely in the toddler years, you want to be teaching them how to feel safe in the water. And don't use the flotation devices such as floaties, because they give us a false sense of security. Bedtime rituals also are really good, because remember, rituals are important to toddlers, and the bedtime rituals help them to feel secure and to know what's coming next, and that it's part of their routine, so they don't fight it. Timeout begins at 2 years, no younger. It gives both parent and child a time to cool down, so both parent and child should be separated from each other. It's not a time for the parent to be lecturing the child. The child is just sitting, thinking, without the parent there in the same space. It removes the child from the bad behavior. Just use a calm voice. It's good to give a warning first, and then if they need to be punished, put them on the timeout, but only with calmness, not with any anger or arguing. And remember, it's 1 minute for each year of life. So you wouldn't do this on a 1-year-old. So you could start with a 2-year-old with 2 minutes, It is a good idea to set a timer for 1 minute per year of age so that you don't forget about them, because that 2 or 3 minutes goes by really fast for you, but not so fast for the toddler. Okay, preschooler, hospitalization. Again, they may regress still just like the toddlers, but they shouldn't be scolded for that. They also benefit with having parents or caregivers at their bedside. Although they can tolerate the parents stepping away a little easier than the toddlers can, it's so good to have them there with the preschoolers. Therapeutic play helps us know what's going on in their heads, so we can see what their thoughts are by like letting them color or do pretend. And then role playing with dolls or little stuffed animals is a great way to help them understand what's going on, what will be happening. So teaching through role playing or dolls. And then let them decorate their space with familiar objects. So it's good to recommend that the parents bring something in from home that would be comforting to them. Preschoolers lie because the line between fact and fantasy is blurred for them, and usually their motivation is to keep to please others. So they want to say or do what they think will be make other people happy. So it's best if caregivers don't ask them pointed questions, because they're likely to say what they think the caregiver wants to hear instead of what the truth is, because they don't really understand as much the difference between the truth and lying. You can help them learn honesty by demonstrating it and having a discussion with them with what you're seeing, and asking them how they can make things work better in the future, to avoid an accident. Masturbation, so just teach caregivers that it's normal behavior, and just to treat it matter-of-factly, and to try to not react in a way that will cause the child to develop negative feelings about sexuality. Playing doctor is a way of exploring gender differences, so that's normal too. And obesity risk factors are genetic predisposition, sedentary lifestyle, and poor eating habits. Interventions, the biggest one is to work with the caregivers to help establish good eating patterns and activity. Actually, for children, having a good active lifestyle, demonstrating that, and doing it as a family, doing it together with the child is probably the most valuable way to help decrease obesity. Nutrition for preschoolers is avoiding really spicy foods, because they tend to not like spicy foods, or foods that are mixed together like casseroles. They don't like those as much. If they get a chance to help with preparing the food, or whether it's helping to grow it or helping to get it on the table, they're more likely to eat it. Frequent small meals with between meal snacks. They do need snacks in between their meals, because they need to eat more frequently due to their small stomach size. And again, food shouldn't be offered as a reward. Dental care, just give the child choices, like letting them choose their own toothbrush. Encourage but supervise them to make sure they brush their teeth twice a day, and visit the dentist twice a year, every 6 months, and also help with flossing. And discipline is, for preschoolers, is to help teach them appropriate behaviors and help them to monitor or develop impulse control. So just make sure that, again, consistency is important, like we talked about before, and be calm and matter of fact. Don't argue. Make the rule setting clear. Remove privileges. We don't want to encourage any type of spanking. In fact, we want to discourage physical punishment because that's associated with problems. We'll talk develop the kids being more aggressive when they grow up. And I just was talking about with the school age kids and adolescents that it's good to kind of talk to them about the consequences and get their buy-in for the behavior. But however, we don't do that step with preschoolers or toddlers. We just give them firm direction. We don't necessarily need to get their input on what they feel is a fair and appropriate consequence. That's a discussion we have for older kids, but not for preschoolers and younger. Just because it's simpler for them just to have clear rules. Okay, now let's do, that finishes up with the review. Now let's do the sample questions. Sorry, it's coming up on the wrong screen, so I'm going to have to change screens. I want it on the other screen, but it's not cooperating with moving to my other screen. So we'll just do this. Okay, so I'm going to give you a chance to do a poll for each of these questions. Okay, starting. Oh, this is so annoying. Just a second. Seriously, go to the next screen. Let's try this. Oh, it's determined to be on that screen. The problem is I can't go back and forth. I can't get my mouse back and forth between the big blue button and the screen. There. Okay, I've got, let's see how this works. Okay, so an 18-month-old is admitted to the hospital. Which would the nurse expect the child to experience? Select all that apply, meaning, and since you can't really select all that apply, I set up the select all that apply so that there's only one answer that isn't right. So which is the wrong answer? A, fear of unfamiliar surroundings. B, separation anxiety. C, guilt for being sick. D, regression. And E, fear of painful procedures. Okay. There's several of you who are still answering. So wait just another 10 seconds or so. Okay, I'm going to publish that result. Oh. Can you guys see the published result? Since I didn't load the slides, I I didn't load the slides because I wanted to be able to add the answer. I can see this is the problem now, but so most of you got it right. So the answer is C. They do not feel guilt for being sick, but they do have experienced all of the other things that are listed there. Okay, next question. There's 20 questions, by the way. Parents should understand that it is, oh, let me give you a poll. Okay, parents should understand that it is best to prepare children for sex education. How? A, before they ask questions. B, in schools and churches. C, at the child's level of understanding. And D, using street terms that they understand. Okay. Let me try this. Oops. So those of you who picked C, which is all of you, publish polling. I'm trying to figure out an easier way to get the poll published. But 100% of you chose the right answer, which is you teach at the child's level of understanding. Okay, oops, I when I had the poll open, I couldn't see your comments in the chat. So was there a question? Getting, okay. Let's move on to the next question. Okay, and let me do your poll. Okay, how does the toddler interpret object permanence? A, no longer believes object disappears when it's out of sight. B, is afraid that mother will abandon him or her. C, believes objects have feelings and motives. Or D, sees himself or herself as the object at the center of the universe. Okay. And I'm going to publish those results. So about half of you are getting it right, and the other half are choosing a distractor. So let's talk about this one. Okay, the answer is no longer believes objects disappear when out of sight. And so the biggest distractor that people were choosing were to see him or herself as the center of the universe. That is egocentrism. So remember, egocentrism is when they feel like they're the center of the universe and that they can't see things from other people's perspectives. Whereas object permanence is when they understand that something still exists even when it is out of their view. Oh, okay. Oh, thank you, Brooke, for explaining that. Hopefully I don't have a short-term memory loss, but now I remember, yes, I did ask you that. Thank you for responding. Okay, next, let me bring the screen back up. So the next one, let's do, Okay, which of Erickson's psychosocial development theories pertains to the toddler? Trust versus mistrust, initiative versus guilt, industry versus inferiority, or autonomy versus shame and doubt? Okay, I am going to publish this. Not all of you responded yet, but I don't want to spend too long on each question. So I'm going to publish this, and now there's your correct answer. So let's talk about your results. So most of you, almost half of you chose the correct answer, but a lot of you were taken in by the trust versus mistrust. So that is for infants. Remember, trust is the foundational psychosocial development. So that trust versus mistrust goes with infant, the very first stage of development. And if you can remember, autonomy is another word, or very similar to the word independence. And if you want to think of the abbreviations AI for autonomy and independence, think of that if that helps you, because toddlers are really working. I mean, toddlers are all about getting their independence with their learning to feed themselves, dress themselves, potty themselves, saying no, learning to say no, having their own will. So remember, toddlers are independence, and autonomy equals independence. What in the chat box? Honestly, most of the questions that are on your exam aren't going to be this straightforward, as in just giving the, let's go back to sharing, giving the names of the stages, trust versus mistrust, autonomy versus shame and doubt, and then initiative versus guilt. The concept will be clear in the question, but know what you do need to know each of these, because I promise there's going to be a question for Erickson for every one of the stages of development on this exam and next exam too. Okay, so next question. Which is correct concerning children in car seats? This is another select all that apply where there's only one answer that is not correct. So let's do E here. All children younger than 13 years should ride in the back seat. B, infants and toddlers should ride in a rear-facing car seat. C, the shoulder belt lies across the middle of the chest and shoulder and not the neck. D, when a child is 3 years old, they can graduate to a booster seat. And E, the safest place in the back is the back seat. In the back is the middle seat. Yeah. Okay. I'm going to go ahead and publish that, and we'll get the answer. The only one that is not, that's check mark is kind of a little lower than it should be. It is when a child is 3 years old, they can graduate to a booster seat. So And most of you did get that one right, so that's good. The safest place in the back seat is the middle seat. So that's generally considered to be true. I know, and that should be updated because some of the newer vehicles make it harder to use the middle seat. So historically, the safest place is the back seat in the middle seat. So I'm pretty sure that I don't have anything that's going to be confusing on the exam, but I can understand why some of you chose that one for the answer. All children younger than 13 should ride in the back seat, ideally. If they have to be in the front, we make sure that they are the oldest child in the car, so as close to 13 as possible, and make sure that the airbags are disabled. No, let's see, infants and toddlers should ride in a rear facing. Yeah, that is true. They should, although we do go by the weight, there's a weight limit. Once they get to a weight limit, depending on the car seat. So we don't give you what the weight limit is because it depends, it varies from car seat to car seat. But ideally, the parents should choose a car seat that has a weight limit that lets the child remain rear facing through the toddler years. And even if their feet are pushing against the back of the seat, it's still safer for them to be rear facing. Okay, let's go back to this. Okay, the pediatric nurse is seeing a 15-month-old child in the clinic for routine immunization. I told you I wasn't going to ask you a lot of questions about immunizations, but I do want you to know something about MMR. So this is going to help you to just review that. The nurse knows that the child is current on his vaccinations, having received measles, mumps, rubella, varicella, Haemophilus influenza B, and pneumococcal vaccines at 12 months. Which vaccination will the nurse give at this visit at 15 months? So it's okay if don't feel too bad if you don't have this one down, because again, I didn't tell you to study the immunizations, but this gives me a chance to review some key things. Okay, I'm going to go ahead and publish this. And so almost half of you I'm not even going to share the published results because you guys were way off on this one. As a general rule, a quarter of you got it right. So let's talk about what the right answer is and why. So remember, nobody chose rotavirus, which is good because I told you that is only up through 6 months of life. They're not at risk for rotavirus after 6 months of life. So yay, nobody chose that one, which is correct. Okay, I'm going to skip the correct answer and go to MMR. So they get 2 doses of MMR, one when they're 1, and this is in routine, regularly scheduled circumstances. And the second dose of MMR is just before they go to school. Okay, and most of you chose MMR, and I can see why, because I was saying I want to talk about MMR. So just remember, MMR is given when they're a year old, not sooner than that, because if we give it sooner, the mother's the passive immunity from the mother clears it without them developing immunity. But the second dose isn't routinely given until they are 4 or 5, just before they start kindergarten. Only one person chose HPV, which that's good that most of you remembered that HPV is the one we give when they're 9 to 11 years old. It's to help prevent human papillomavirus, which is an STI. Okay, so DTaP is the correct answer. Oh, there we go. So DTaP is given really frequently. So if you can see this row right here, they get their first dose at 2 months, second dose at 4 months, third dose at 6 months, and their fourth dose between 15 and 18 months. So that's the one that's given the most frequently on all of the options. So that's a safe guess. If, not that you're going to need to guess, but okay, moving on. Okay, which activity demonstrates a 7-month-old has mastered the pincher grasp? A, he picks up a small morsel of food. B, he reaches out to grasp bright colored objects. C, he brings fingers to his mouth. Or D, he rolls over from his abdomen to his back. Well, it's nice to see you guys are getting this one. So the vast majority of you are choosing the correct answer. So it seems like every question, there's a few less people answering. Are you guys falling asleep? I can't see your responses, so don't worry about it if I'm watching to see if you get it right or not. Not that you'd be afraid of me, but yeah, okay, that's a good response. So I'm going to publish that. Oh, I didn't give you your right answer yet. Okay, so most of you got it right. The right answer, the pincher grasp, is picking up a small morsel. So it's that opposable thumb. So this is our pincher grasp. Okay, very good. Next. Most, oh, let me give you your polling options. Okay, most infants with normal motor development can sit alone at which age? 4 months, 5 months, 6 months, or 7 months? Oops. Okay, so let me publish your result. Okay, a lot of you chose 6 months, which is actually, it's probably true that there are lots of babies who could sit alone by 6 months. The correct answer is 7 months. I'm not going to give you a question that splitting hairs on the exam, so don't worry. It'll be way more obvious. That one was really a hair splitting one, but we say 7 months because that means that's the latest point where they should be sitting up. If they're sitting up at 6 months, that's great, but we for sure, it's fine. We don't worry about them if they're not sitting up at 6 months, but we want to see that they're sitting up by the time they're 7 months. Okay. Next question. Okay, the typical 12-month-old will do which for verbal skills? Coo, babble, say a few words, or have fluent speech? Okay, I'm going to publish that. I'm also going to look at the chats because I can see there's some chats. Okay, so most of you got it right. We do expect them to be able to say just 4 to 6 words by the time they're a year old. So they should be able to coo and babble, but developmentally we want them to progress to say a few words, but we don't expect them to have fluent speech. All right, next question. This is, okay. Which is the purpose of play during infancy? A, to promote toilet training. B, decrease hyperactivity. C, generate self-defense. Or D, exploration of the environment. Okay, I'm going to move through these a little more quickly because my goal is to be done by 2 o'clock. So I'm just going to publish the results more quickly. So if you want a chance to answer, try to answer as fast as you can. Okay, so the right answer, most everyone got, which is to explore the environment. And I guess I won't worry about showing you the full results. I'll just verbalize what they are. That'll save a little time. Okay, the nurse is teaching, oh wait, let me give you your polling choice. Okay, the nurse is teaching the parents of an 8-month-old about what the child should eat. Which information should the nurse include in the teaching plan? A, items from all food groups should be introduced by the time the child is 10 months old. B, solid foods should not be introduced until 10 months of age. C, iron fortified foods should not be introduced until 12 months. Or D, the infant's diet can be changed from formula to whole milk at 12 months. Okay, good. I'm going to call it there. Most of you, so almost half of you got it right. So which one is true? The infant's diet can be changed from formula to whole milk at 12 months, okay? Iron fortified foods should be started at 6 months, not 12 months. Solid foods, they can they can be given like crackers to gum. They start teething around between 6, as early as 5 to 7 months. So we can give them crackers, and they like to kind of gum those crackers, so that's fine. Way before the 10-month. And several of you chose the top one. We're not as concerned about giving them a well-rounded diet as we are introducing iron fortified foods, and also introducing foods one at a time slowly, so we can develop we can be aware if they develop allergies or have allergies to any of the foods. So that's more the focus, instead of getting the well-rounded nutrition by 10 months. Okay, next one. Okay, a mother states that she thinks her 9-month-old is developing slowly. Which motor skills should this child be demonstrating? This is another select all that apply. That there's only one wrong answer. Oh, I should have given you an E, 5 option. Okay, so a 9-month-old should be doing which of these? A, drinking from a cup. B, walking alone. C, crawling. D, sitting alone. Or E, rolling over. So most of you are getting that right. They should be They should be doing all of these things except for walking alone by the time they're 9 months old. Okay, which infant most needs a developmental referral for gross motor delay? And remember, when there's a test, you need to look and see, is the gross motor, is it asking, if it's asking for motor skills, notice if it's asking for gross or fine, and to distinguish them. Because if the question is asking specifically for gross motor, don't choose a fine motor as your option. Okay, so the 2-month-old who does not roll over. B, the 4-month-old who does not sit without support. C, the 6-month-old who does not creep or crawl. Or D, the 9-month-old who does not use a pincher grasp. So as you're studying, put these developmental charts, like I'm showing up here, put the developmental charts into your long-term memory. Because knowing the information on the developmental charts, especially the stuff that I just went through and highlighted for you at the start of this review, is really going to help you. So not very many of you, only about 15% of you have chosen the right answer on this one. So let's review that. 2 months old, we don't expect babies to roll over until they're 4 to 6 months old. So we don't expect a 2-month-old to roll over. A 4-month-old, we don't expect a 4-month-old to be able to sit without support yet, because we want to see that they're sitting without support by the time they're 7 months old. They can start a little earlier, but we're not concerned if they're not starting before 7 months. We don't expect them to learn to crawl until they are 8 to 9 months old, and creeping is a step above that. Or creep and crawl, both, they're similar enough. Anyway, we don't expect to see them creep or crawl until they're about 8 to 9 months old. And as we do expect they should be using a pincher grasp by the time they're 7 months old. Remember that. Think of this as making a 7. Oh, where's the camera? Can you guys see me? This is a 7. Pinch it. Number 7 with my finger and index finger pinch. So this, if that helps you to remember, they can pinch at 7, okay, 7 months. A 2-year-old is, pulling options. A 2-year-old is afraid to go to sleep because the monsters will get him. Which should the nurse tell the parents? A, allow him to sleep with his parents in their bed when he's afraid. B, increase his activity before he goes to bed so he's exhausted. C, read a story to him and allow him to have a stuffed animal at bedtime. Or D, allow him to stay up late so he falls asleep and carry him to bed. Okay, and I'm happy to see so far everybody's getting this one right. So that one's good. Read it, part of the bedtime ritual, the story and the stuffed animal. Excellent. We will move on to the next one. A mother of a toilet-trained 3-year-old expresses concern over her child wetting the hospital bed. Which should the nurse tell the mother? A, he is too young to be toilet trained. B, children are often afraid in the hospital. C, it's common for children to regress in the hospital. Or D, this is normal when children get IV fluids. And again, it looks like everybody's getting this one right. Makes me happy. There was one person who chose B, which isn't wrong, but there's a better answer, okay? So be sure you read through all of the options and choose the best one, because it's not uncommon for us to give you more than one right answer as an option. You just have to know to choose the best one. Okay, when assessing a 2-year-old child brought by his father to the clinic, which should the nurse expect the child to be able to do? A, stack 6 blocks. B, ride a tricycle. C, tie shoelaces. Or D, kick a ball. Okay, again, most of you are getting this one right. So about 2/3 of you are getting it right and 1/3 of you are choosing a distractor. So let's talk about that. So what is correct is for a 2-year-old is to stack 6 blocks. If you can remember at like a year-old, they can stack 2 blocks. When they double their age, they can double the height, 2 to 3 blocks for a year-old. 2-year-old can stack 6 to 7 blocks. The other option that some of you were choosing as a distractor was kicking the ball. Kicking the ball requires balance because they've got to balance on one foot while they kick with the other. So that is actually, we don't see that until they're a little older, more in the preschool age. Okay, next poll. The parents asked the nurse for advice about disciplining their 12-month-old. Which technique should the nurse explain? Okay, so this is still on the infant chart. A, distractions. B, spanking. C, reasoning. Or D, time out. Okay, so far, a little over 1/3 of you have chosen the right answer. That is distractions. So nobody chose spanking. That makes me happy. Reasoning, that one is better for older children. So infant, 12 months is still on the infant stage. So I mean, it doesn't hurt to talk to an infant, but it's not the best way. You're not going to just reason with them to stop. It works better to distract them, and that should be the just to say distraction would be more effective than reasoning with them. And then timeout, remember that is just for, what's the minimum age that we use for timeout in the chat box? Yeah, redirect is a distraction. Thanks, McKinney. Okay, yes, 2 years. Excellent. So remember to look at the age. Whenever we're talking about timeout, remember to look at the age and to see if it's even appropriate. Okay, next one. To encourage autonomy in a 4-year-old, the nurse should just instruct the mother to do which? A, discourage the child's choice of clothing. B, button the child's coat and blouse. C, praise the child's attempt to dress. Or D, tell the child when their clothing choice is inappropriate. Oh, and you guys are all choosing the right answer. So everybody has chosen the right answer. So we're ready to move on. The next is, okay, when developing, I typed these in a hurry, I'm catching typos. When developing the teaching plan about illness for the mother of a preschooler, which should the nurse include about how a preschooler perceives illness? A, as a necessary part of life. B, a punishment for wrongdoing. C, the will of God. Or D, a test of self-worth. Okay, and most of you are choosing the correct answer here. So, which is a punishment for wrongdoing. So they don't quite get that it's a necessary part of life. A few of you chose that as a distractor, but they see it as a punishment. That's how they interpret it. The pediatric nurse should avoid using therapeutic play with a hospitalized 6-year-old at which time? A, at bedtime. B, during preoperative teaching. C, before a diagnostic test. D, when the child is stressed. And notice this is saying when to avoid it. Oh, I didn't give you your options. So we're looking for when to avoid therapeutic play. Okay, and most of you are choosing the correct answer. So I'm going to give that to you. And a couple of you chose some distractors. So remember, we do want to use therapeutic play when we're teaching them, and before we do a test to kind of distract them, so to help calm them so they're not getting worked up and anxious about it. And stress is also a good time to use play because it can help calm them. Oh, that was it. Okay, so you guys are excused, and anybody who wants to can stick around and watch this video. This is totally optional, but if anybody, it's just for the fun of it. If you want to watch or the teen lingo, and this popped up really quickly after the coronavirus. Oops.